Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is a career in medical coding worth it? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, let me read this comment and then I'll get into it. So here we go. Alright, so the viewer says, I couldn't find a job with my CPCA, so I decided to purchase a CCS program and try to pass this. It is much harder, but I wonder if it's even worth it. I feel scammed and I can't recommend this to anyone. All right, so here's the thing, guys. First of all, yes, you can get a job with the CPCA. How do I know? Because I have a growing YouTube channel and people tell me all the time that they've watched my tip videos on resumes and on interviews and they've been able to get a job with the CPCA. I'm just saying. I've also written resumes for people who have a CPCA and they've been successful in their job search. So with that being said, it all has to do with your attitude when you're out there looking for a job. And are you looking for jobs that are even asking for 3 to 5 years of experience? Because if they are, you're still going to apply anyway. It's those that get stuck in that mind frame, oh, I'm looking for an entry-level position. If you're looking for an entry-level position, you're never going to find it. Or it's going to be like a needle in a haystack. And even if you do find a job listing that says, this is an entry-level medical coding position, rest assured there's going to be thousands of people that apply for that job because that's what they're looking for too, right? An entry-level job. And when they do that, then you're just going to go lower and lower on the list of people to look at. Also, something to consider when you're out there with the CPCA is that the fact that what does your resume look like? If your resume does not list all of the skills that you learned in the school, and if your jobs do not list your transferable skills, again, guys, you're setting yourselves up to fail. Now, this person has what I call a victim mentality because of the simple fact that says, I feel scammed and I don't think I can recommend this to anyone. Do you know there's people out there, and this comment is going to be deleted after this show, but I wanted to save it for the show. But there's people out there who will see that, get scared, and not pursue medical coding because of one person's experience. Now, this person is not even out there in medical coding yet. They just feel scammed, and they don't think that they can recommend it to anybody. It's not on you to recommend it to anyone, all right? It's not on you. What is on you when you're sitting there saying your recommends is the program that you went through. Did you learn anything from it? Your experience while you were in the school. That's your thing that you can recommend, not the whole career, because you're not even there yet. I'm just saying, if that's you, if you are in that mentality, not necessarily this person, but anybody watching this, if you're in that mentality, think about what you're saying when you're saying it, which is why I tell you all to stay out of Facebook medical coding groups. Now, I watch these comments like a hawk because on my channel is for the positive. My channel is for the realistic, all right? So you decided to go from a CPCA and you say now you're going to go after the CCS, and now you figured out that it's 10 times harder. Well, here's the thing. I've said it many times on my channel, and it is known in the industry to be the gold standard when you get that CCS. That CCS is a heck of a lot more and covers a lot more than the CPC does. The CPC only covers outpatient coding, right? The CCS says that you have mastered not just outpatient coding, but inpatient coding as well. And you're using 3 different classifications of codes, right? The ICD-10-CM, ICD-10-PCS, and the CPT code sets. So that's something that you have to think about. It's knowing not just how to code from the CPT manual, which is the basis of the majority of this CPC test, but it's also knowing how to code for ICD-10-PCS, which is a lot harder because you have to build those codes. Some of the codes are built, very few, but you have to know surgical approaches, you have to be really good with anatomy. And the thing about it is, as speaking as somebody who has experience, has been in this field, I can speak on experience. I can recommend it or not recommend it. Now here's the thing, guys. I say that this is a great field, but you're asking, or you're saying this to somebody who is biased because I love what I do. I understand and accept the fact that you're going to have to continue to study, because we have to know what doctors know while never having gone to medical school. And there's a lot of you that don't know that. And then the ones that just heard it just now, they're like, oh my gosh, am I going to be able to learn this? Yes, you can, because I didn't have a background in medical, but I learned to do my research. I learned to love it, and now I don't feel like I'm working when I'm at work. So that being said, with that in mind, the thing about it is, guys, you have to decide what you want. And yes, in the growing process and in the process of improving yourself and improving your life, your career, it's going to get uncomfortable. But a lot of you want to run away from being uncomfortable, which sounds a lot like this viewer. Wants to run away from the uncomfortable. Oh, I don't get it. I have said many times, if you're in a program and you don't understand, you need to find a mentor or you need to find a tutor. Somebody who can help you to understand what this is, or somebody to explain things to you. Or if you are like getting stuck on like medical terminology or anatomy, that's something that you can brush up on your own. There's a ton of channels on YouTube dedicated to those things. So you definitely can look at those and see if maybe changing it up to not just working with a book, but actually watching a video will help you. A lot of times adult learners don't think about just different ways of learning. You think, oh, I have to learn from a book, right? It's not always learning from a book, guys. There's different ways, and sometimes that's what your brain needs. It needs that, like, oh, okay, now we get it. And it all has to do with the brain, guys. You know, if you are doing something, of course, that you enjoy, there's going to be that increase in dopamine. If you are doing something that is boring to you, of course, you're going to look for that. Where is the dopamine? Your brain is going to be looking for, where is the dopamine? It wants something fun. And this is not always going to be fun. But that's the part about that you have to understand. We should only be studying for no more than 1 hour at a time. You get to 1 hour, then you stop. Or study for 30 minutes and stop and take a break. So that way your brain can absorb what it just did and then reset. Because that's what we need to learn this. It's not always going to be glamorous. It's not always going to be fun. It's very irritating when I see comments like this, because of the simple fact that you think that this is something that you're going to be able to coast right in and just be able to do really easy. And then you find out that it's not. And then you want to sit there and tell the world that you don't think that it's good. It is good, guys. I will tell you from experience that it is good. When I got into this, I had no idea about medical coding. I didn't even know what it was when I got into the school. Then when I got into the school and I was going through it, I was feeling those pains too, but I kept trucking on because of the simple fact that I wanted to have a better life for myself. I was going through a divorce. I had moved out of my husband's house back to my mom's house, and I was trying to get my life going again. I was in my late 20s and trying to get myself going again. And I said to myself, I want to do something good with my life. I don't want to have to work in minimum wage jobs, and I don't want to have to struggle. I don't want to have to struggle financially. This career field has given me so much freedom, and it has paid me 100-fold. Now, this was a gift to me. I was unemployed. So at the unemployment office or the workforce office, they offered, I had to go to a class that said, well, if you want to go back to school, take this class, and, we'll set you up with a program that we pay for. And the only requirement is that you get a job in the field that you were trained. And I said, oh, okay. So they had all different kinds of things: beautician, truck driving, accounting, and then they had medical assistant and they had medical coder. Well, I know I don't want to do nothing with no medical assistant. And so I heard medical and I said, oh, I don't want that. I want the accounting because I'm a numbers nerd. I love numbers. And so they said, my case manager was like, well, what about medical coding? And I said, oh, no, I don't work with needles. And he's like, it's not with needles. It's all about reading. It's all about putting diagnoses and procedures into codes for the insurance company for statistical purposes. And so I said, oh, that sounds kind of interesting. Well, long story short, here I am, guys. Here I am. And then now I have a channel where I talk about it with all of you. And people out there are watching the channel. Sometimes they don't know if they want to go into this, or is it too much? Is it so much of an investment? The things that are that are hard to get, the things that you have to work hard for, are the best. And that's what I've learned in this life, is that the things that you have to work hard for are not the ones that are going to give up on you very easily either. There was a very difficult time in the beginning of my career, and I don't want to get into it, but I really leaned on the medical coding. I really focused on, learning, and I focused on doing my work so that, during the times when I was at work, that this is what I really concentrated on. And this I could completely lose myself in. And that's exactly what I did, because then the rest of the world, the real world, could hit me right after I got out of work. Go through whatever it is I was going through at the time. And so that's the thing, guys. It was just about, okay, now I discovered I like it. And then I discovered in 2014 that I actually love it. I would get excited to go to work. I would get excited to see my providers and give classes and talk to them and educate them and do all of these things and see their documentation improve. And that just really it did something to me, that it was just like, this is passion. Now I understand what they say when they say, if you love what you do, you never work a day in your life. And so with that being said, as a veteran coder, as somebody who's been in the field, yes, I can recommend it. However, I will say that it's not for everybody. I don't know if it's for this person who is hopping from credential to credential, trying to find a way to get in, trying to find a way to get a credential and then to get a job. If you don't understand what power your credential already holds, that's part of the issue there. That CPCA apprentice is still a great credential anyway, and employers will still hire you even with it. And it doesn't mean that just because you have it, you can't get a job. Again, I've always said, look at your resume, look what you're putting out there. Look at your attitude when you're out there applying too. Are you being proactive? Are you just only applying for certain types of jobs? Meaning, are you only applying for remote medical coding positions? Which I tell you all as brand new medical coders, don't do it. You need time to be in a facility where you can learn from veteran coders, where you can be around providers so that you can learn. I think that, yes, there's some people, like at the beginning of the pandemic, that they were able to be brand new, work at home, and they're just fine. But I do think it stunts their growth a little bit if they've never been in a facility. And there's some that still haven't been in a facility, haven't been around other medical coders. And I guarantee you there's a lot more they can still learn just from being around others. So that's what I want you guys to know. I want you guys to know that it's not just about, oh, well, the school told me that I can work remotely. The school's going to tell you whatever they need to tell you to get your money. I mean, plain and simple, that's all they're going to tell you is whatever they need to get your money. But if you want to only apply for those types of jobs, remote jobs, of course you're going to be looking for a while. That's going to be the thing, because before the pandemic, if you didn't have 3 to 5 years of experience, you were not getting a call back. And I could just imagine what that resume looks like. I just keep going back to the resume because I know that's probably a lot of the problem right there. And then the other thing is, if you're not trying to apply for like other alternative positions that can get you some experience so that you can get your foot in the door. Medical billing is the number one thing that I say that coders can use to get in, because a lot of times medical billers don't even have to be certified, unfortunately, I think, in medical coding. I think it's important for medical billers to know coding. There's a lot of medical billers that will disagree with me, but I think the proof is in the pudding, okay? Especially when you see those denials, and I'm just saying, But with risk adjustment, it's just diagnosis coding, but it's a way to get your foot in the door as far as like, okay, learning the electronic medical record and kind of learning the process of looking at the record and that kind of thing. Don't get stuck in risk adjustment. I had to explain myself again in the comments because somebody said, well, what do you mean don't get stuck there? Exactly what I said. Don't get stuck there. It's been like 6 to 8 months in a risk adjustment position. That's fine, and that's good enough to learn, and you can get faster with looking at the record. But keep in mind that risk adjustment is only diagnosis coding. It does not include CPT. It does not include evaluation and management, and it definitely does not include modifiers. So you're going to lose your knowledge if you stay in a risk adjustment position long, as far as like your knowledge in procedure coding and modifiers and E&M. So that's why I'm saying, guys, you want to get in a position that's going to give you that well-rounded exposure to coding, all right? That you can code for procedures, you can code for diagnoses, you can code for evaluation and management. At least that. I'm just saying, guys, because I want you all to be set up for success. And that way you can have more opportunities to do the things that you want to do. Because you don't want to stay in your entry-level frame of mind for very long. You are trained. You have a credential. This credential says that you are competent to work in medical coding. Now, if you went in through a medical coding program that they just taught you these exam pass strategies, how to crack the test, which I think sounds so stupid, by the way. When you say, oh, well, I was just taught how to pass the test. Okay, so now it's your turn to take the bull by the horns and go get those workbooks that I've recommended. They're in the description box below, so that way you can practice on those. Because just because the school taught you how to pass the test doesn't mean that you have to be, that's all you know. Take matters into your own hands and start learning it on your own. And for those of you who ask me, well, how do I learn again? I didn't learn, I forgot how to code. I haven't coded in 5 years. I haven't coded in 10 years. Get the independent study list. Go through all those books. Refresh yourself on the things that you have forgotten. If it's medical terminology, if it's anatomy, if it is ICD-10-CM, right? Because things have changed. If it's CPT, things have changed. And, you know, that's what you have to do. Evaluation and management changed from 5 years ago. So there's a lot of updates. Review the coding guidelines. They can be downloaded for free on the cms.gov website. Okay, that's all you have to do. You can Google these things and let your fingers do the walking, or you can go to the description box and you can see all the information I have there, including the syllabus on the independent study video. All right, and all my other book recommends for pharma and for pathophysiology, they're all down there. I'm just saying. So that's the thing, guys. You got to keep your head up, and you can't be running around spewing negativity like this. All right, and especially on my channel, guys, it's not gonna, that comment won't last very long, because like I said, my channel is for those who want to be realistic. And yeah, there's a lot of people that come to my channel that they were scared because somebody said this or somebody said that, and it's not necessary, guys. Keep your head down. Make sure that you're studying 20 hours per week. That's what you need to put in. 20 hours per week is what you need to put in. You're doing anything less than this, you're not going to learn it, and you're not going to learn it fast enough. I'm just saying. So with that said, I'm going to go ahead and wrap this one up, guys. But make sure when you are listening to advice that you listen to people who have experience and who know, not like individuals who are like this with one credential and hop into the next credential and really realizing, oh, it's really hard. Listen to those who know, all right? And make sure that it makes sense, that what they're saying, because it's not something that's going to be self-serving to them. They're not trying to push a program, or they're not trying to do this, or not trying to do that, but they're just saying from their experience. And I'm saying from my experience, it's a great field. I've grown so much with it professionally, personally, and I continue to look forward to a bright future with this, because there's so many things you can do in health information. I'm just saying. So if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.